kids. When it comes to keeping your heart We're advancing health with state-of-the-art diagnostic care to ensure your heart is working properly. And should a problem occur, from heart attacks to irregular heartbeats, Tanner offers innovative care. So your heart... Advancing heart health with medicine beyond measure. To find a heart specialist, call 770-214-CARE.
Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us on this beautiful Monday morning. And we've got another week of Community Voice is lined up for you and our listeners and viewers. So thank you for tuning in and watching. 678-601-8255, 678-601-TALK is our phone number to call. And you can make a comment on Facebook Live. Our guest in studio is Marcy Sanders Heath of Insurance Solutions. Good morning.
Good morning.
We normally just do a show once a year.
Correct.
And we've been doing it for 8 years, as we like to say, when we're something like that.
Yes, I think a little longer.
Yeah, because we were a year ahead, so 9 years. So we'll be celebrating our 10th year anniversary next year. Ain't that great?
That's exciting.
What are you going to get me? Anyway, our topic, Marcy is owner-operator of Insurance Solutions. Our topic for the last almost decade now has been Obamacare and the Affordable Care Act. And we have coming in today because number one, open enrollment is ongoing right now.
It is.
And because President Trump issued an executive order.
He did.
And so we want to talk about both those things as opposed to just waiting till next year and doing our annual show. So bring us up to date. Open enrollment's ongoing. How long is it lasting for? And basically, how's it going for everybody?
So open enrollment started November the 1st. It has, for me, opened up a little slow as far as, clients calling in. It's not as busy as it was last year. Last year Humana pulled out of the market, so everybody was switched over to Blue Cross and Blue Shield. So that was a major, deal. But it's kind of going slow. I think a lot of people are really confused, and I can totally understand why. You've had several attempts from Congress to try to overhaul and repeal and replace Obamacare with failed attempts. I know House got their plan passed, and then Senate failed, and then you had Trump that came out with his executive order, and then you had Trump the day after, which ended the CSRs, which is the cost share reductions. So a lot of people is just really kind of confused.
Well, that's why we're here.
Yes.
Okay, but tell us basically how many providers now do we have in West Georgia? We
have one.
Which is?
Blue Cross and Blue Shield.
Okay, and how are the rates going? Are they up and down, or?
So here's the situation. Now, if you are an on-marketplace subscriber or enrolled, and let's say that you're in the marketplace and you're receiving a premium tax credit, a lot of people has confused the CSR, which is the cost share reduction, along with the premium tax credit, and they are two totally separate things. Okay. Your premium tax credit is the credit that you get that makes your premium lower to where you can afford it every single month. Now, if we remember way back in the day at the early stages of Obamacare, the premium tax credit was protected by the lawsuit and that was won, the King versus Burwell. So premium tax credits are protected by that. The CSRs, yes, Trump did end the CSRs. So what happened was insurance carriers then had to kind of go back and say, okay, since we're not going to be getting that money from the federal government, then we're going to have to raise rates in order to be able to to compensate ourselves or not take such a loss. So that's exactly what they did. Blue Cross and Blue Shield for this year went up 57.5%. Now, here's the thing. For those people that are enrolled in the marketplace that receive a premium tax credit, those tax credits have risen for 2018. So it's overshadowing that 57.5% rate increase. The people that are hurt and that are going to be highly affected by it are the people that do not receive a premium tax credit because your income does not fall within the guidelines to receive it. So like you, me, several other people. I think there was about 500,000 last year that had enrolled in private plans. And then as of February, you had about 404,000 that had made their plans effective by paying their first month's premium. So you've got about 500,000 people that are in our situation that's going to just have to eat that 57.5% rate increase.
What are those guidelines? Well, from what income to what income are not eligible for that?
So, like say,
tax credit?
if you're an individual and you have no tax dependents, you live by yourself, you're not married, no children, the lowest income that you can make is around $12,220, and the most that you can make to qualify is going to be around around 48,000.
Mm-hmm.
And then, of course, for a married couple, you have to make $16,240, and the highest income that you can make is around $65,000.
Okay. All right. This is so simple.
I know.
Golly. I've heard several people in recent weeks just throw their hands up and say, I can't afford this. You mentioned 57% on Blue Cross Blue Shield. And they just throw their hands up and say, I can't afford this. I'm just not going to have insurance. And they boldly declare, and you've encountered those people. And how do you respond to those?
So, and that's one of the good things about Trump's executive order is the short-term policies, which we had a huge success with last year. The plans are 1/3 of the cost of the cheapest Obamacare plans. We were able to provide those last year. We could offer those for a 12-month period. Of course, that was still during the Obama administration, and Obama's all about numbers. He wanted his Obamacare, ACA marketplace, to thrive and look good, for his legacy, and that was chipping away at his numbers. So he came in and said, okay, I realize, his administration said, okay, I realize that this is affecting the enrollees coming into the marketplace. So what we're going to do is we're not going to allow consumers to purchase the short-term major medical plans for a 12-month period anymore. We're only going to allow you to purchase them for 90 days. So you can renew them, but then it's just the hassle of having to renew it every 90 days. And then every 90 days your deductible starts over, and then your co-insurance starts over. So it just kind of threw kind of a hack in it. So I think that if the plans will follow through, as far as one of the executive things in the executive order is that Trump wanted to to take it back and extend those, and those will be an option. And of course, I have several other options. Our industry does not, sit back and just allow one insurance carrier to dominate the market. So we've had several insurance carriers that have been kind of creative with plans. So we have several different things we can offer.
So when does open enrollment end?
December the 15th.
Okay, so a little over a month. Okay, well, we're going to take a break, and we'll come back. I'm going to try to untangle this a little bit more with Marcy Sanders Heath of Insurance Solutions. But first, this word from Tanner Health System.
Who holds the key to your heart? Your spouse? Your children? Or is it your grandkids? When it comes to keeping your heart beating strong, you'll find Tanner Heart Care holds the key. With preventive services to keep you healthy and the region's largest network of primary care providers experienced in quickly catching cardiovascular problems, your heart is in exceptional hands at Tanner. That's because we're advancing health with state-of-the-art diagnostic care to ensure your heart is working properly. And should a problem occur, from heart attacks to irregular heartbeats, Tanner offers innovative care, so your heart can be there for the ones who hold it, strong and safe. Tanner Health System, advancing heart health with medicine beyond measure. To find a heart specialist, call 770-214-CARE or learn more at tannerheartcare.org.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host. Glad to have you with us. You can follow us on Facebook Live, make your comments there. Call us 678-601-TALK. We're talking to Marcy Sanders Heath. We're doing a special program because we're, one, in open enrollment, and two, there's been an executive order by President Trump regarding Obamacare. This was so much easier before the federal government got involved.
It was.
I mean, it's just for everybody.
It was definitely better. We had more competition. Right now in the individual market for ACA, like qualified health plans. And what I mean by qualified health plans is that those are the ones that contain the essential health benefits. We have one carrier. We have Blue Cross and Blue Shield. Outside of the ACA, we've got, several different, options. But of course, those don't cover pre-existing conditions. And you can be denied. But prior to that, we had probably 8 to 10 carriers that we could choose from.
Proponents of Obamacare always say, well, at least we've got pre-existing conditions covered. Is that true?
We do have pre-existing conditions covered.
Which wasn't true in the past.
That is correct.
Okay.
And I'm always honest, and that's one thing that I definitely blame my industry for. I think that they could have got together and figured out this whole pre-existing thing way before the federal government jumped in.
One thing I heard in one news story regarding the executive order was the idea that now you're going to be able to buy across state lines, thereby increasing competition. Am I correct on that?
So what the executive order did is it hasn't actually put anything in place right now. So what it did is it put on notice, it put the Secretary of Treasury, Secretary of Human and Health Services, HHS, and Department of Labor. The Association Health Plans, we call them AHP for short. So that can cover small businesses, trade groups, unions, and self-employed individuals. Associations wouldn't have to meet ACA benefit requirements or cover a minimum percentage of employee health care costs, and they would be able to travel across, state lines. But as we know, Tom Gray Musgraves, before he went into Washington when he was still in Georgia. That was one of the things that he passed in Georgia, was for Georgians to be able to buy across state lines. So Georgia already has that in place to where we can go across and we can buy from like Alabama or Florida or Tennessee or South Carolina.
I've never heard that.
He did. He put that in place to where we could do that. The problem and the reason why we cannot do that is because you don't have the other states that have it, that have implemented the same thing.
None of those have implemented the same?
No.
Huh. Mm-mm. One thing I heard in one news story regarding the executive order, which kind of tended to explain it to me better, was that the insurance companies were getting like $180 or $180 billion in subsidies.
That's the CSR. That's the cost share reduction.
Okay, so that was money going into their pocket.
Correct.
Which allowed them to underwrite the health insurance of those who were eligible at that level, right?
Mm-hmm.
Am I right on that?
You'll have to rephrase your question, but yes, the
Well,
federal
explain
government.
it to me.
So yes, the federal government, that was one of the things in the Affordable Care Act.
So that's why they were supportive of it, because they were getting that money to move around.
Well, they were getting that money to move around, but in the same sense, you got to remember that health insurance carriers now, to where they used to be able to assess the risk that they were taking on, they are unable to do that anymore.
Why?
Because the Affordable Care Act made it mandatory that you do away with any pre-existing. So during open enrollment, if I have cancer or if I have AIDS, I can get a policy in January the 1st. It doesn't matter what I've got, that company is going to start paying for my medical care. Mm-hmm. Well, the insurance carriers have no idea who's enrolling during this time. We're not allowed to ask any kind of medical questions, so therefore they don't know what they're getting until those claims start hitting. Mm-hmm. So prior to, they were able to kind of know their risk. They don't anymore. So that the money from the federal government was to come in and was to kind of help them, help them alleviate some of that, cost of taking on that risk. But, to where everybody's kind of criticizing Trump, for taking away the cost share reductions, as a Republican and as a conservative, I would think that most people would be happy because, hey, you're not billing out the insurance carriers anymore. Isn't that's what everybody's always kind of screamed about is, oh, well, the federal government's always, billing out insurance carriers. Well, he stopped that. Mm-hmm. But yet it's not going to hurt the consumers any, because in the ACA law, Obama administration put it in there to where regardless if those CSR payments come from the government or not, the insurance carriers still have to give that to the consumers. Mm-hmm, mm-hmm. So we're not being affected by it except for with higher premiums. But we have that premium tax credit that's coming in to lower the hike of the... Am I losing you?
No, I'm trying to follow this.
So we've got the premium tax credit that's coming in that's lowering, the rate increase.
So those who would criticize and charge this is nothing more than a large redistribution of wealth scheme. There's some truth to that, correct?
Say that one more time.
If indeed some have charged this as a redistribution of wealth scheme in large part, because we're underwriting... with the money going to the insurance companies, then you have the premium tax credit, basically you're leveling the playing field, i.e. redistributing the wealth.
So the premium tax credits, basically what that is a tax credit, okay? Now, you and I know probably don't fall in this boat, but you have several people that fall in that category, okay, or in that 100 to 400% of the federal poverty level. 9 times out of 10, when they file their taxes, they're getting like 10, somewhere around $9, $10, $8, $12,000 back.
Mm-hmm.
So what that does, the premium tax credit is just it's pulling from their credit.
Mm-hmm. Mm-hmm.
They're going to get it anyway, so why not let them use that money prior to them getting it and use it towards health insurance? So it was their money anyway. Do you understand what I'm saying?
Yeah, I think so. But now we often hear that sometimes people fall through the cracks under the system.
They do.
Where are they located? What range are they in?
So we have a lot of people in Georgia who fall up under the federal poverty level. Of course, Georgia, along with the 19 other states, still have not upped the Medicaid. So I had the numbers here. I think it was close to about 300,000 that's in the coverage gap. And of course, that's just kind of been like a dead discussion in the state of Georgia. But February of 2016, Senate Bill 368 was introduced, and that was the first time a Medicaid expansion bill had gained a hearing by the General Assembly in Georgia. So they're kind of making steps towards it, as the health insurance, world continues to, be a little more complex, because it doesn't seem that those people are gaining access to care.
And before we take our next break, one little fun fact that you may or may not know: on November 2nd, the U.S. House of Representatives voted 307 for and 111 against to abolish the patient advisory boards under Obamacare.
I saw that.
Yeah, how about that? The death panels are being put to death, at least by the U.S. House.
I know.
We'll be back with more after this word from Tanner Health System.
Who holds the key to your heart? Your spouse? Your children? Or is it your grandkids? When it comes to keeping your heart beating strong, you'll find Tanner Heart Care holds the key. With preventive services to keep you healthy and the region's largest network of primary care providers experienced in quickly catching cardiovascular problems, your heart is in exceptional hands at Tanner. That's because we're advancing health with state-of-the-art diagnostic care to ensure your heart is working properly. And should a problem occur, from heart attacks to irregular heartbeats, Tanner offers innovative care, so your heart can be there for the ones who hold it, strong and safe. Tanner Health System, advancing heart health with medicine beyond measure. To find a heart specialist, call 770-214-CARE or learn more at tannerheartcare.org.
Good morning. Welcome back to the Community Voice. I'm Steve Gradick, your host. We're talking about Obamacare with 7 minutes left, and we want to, now that we've got everything clearly explained, I'm sure, with all of that said, what is the future for healthcare insurance in America in the next year, next couple of years? What do you see on the horizon?
Well, if from the executive order, hopefully we'll see some good stuff coming out to where it's, we can buy across state lines, association plans, to where, like, small businesses, I've got several small businesses that could group together, that would be able to purchase insurance. You've got the HRAs, which was another thing that he discussed in his executive order. Prior to Obamacare, you had your small businesses to where it was too expensive to purchase group insurance. They just allotted their employees like a defined contribution, like $300 a month to be able to go purchase their own policy. And then, of course, the exchanges came out, and they still were giving them the $300. Well, then Obama administration said, oh, no, you can't do that anymore. So they made that illegal to do. So I think that will open up a lot of opportunity. And then, of course, the short-term policies, I think, would be a good thing. But as far as the marketplace is concerned, it's going to be really interesting to see in 2018 especially after the cost share reduction has been pulled. That was a lot of money going towards the insurance carriers.
What was it? Was it $180 billion? It was somewhere up there.
It was
an enormous
lot.
Amount of money.
It was a lot. Which, of course, now, the last time I was here, I was telling you about the revenues of Blue Cross and Blue Shield. So now they're not hurting by any means, but I think that it's going to be very interesting to see in 2018 of who's in, who's out, how this is going to affect them, for 2018. So I don't know. It's going to be very interesting to see.
So why can't Congress just repeal the darn thing and be done with it?
Well, because you've got a couple that's in Senate that
So political is
it's political.
Okay.
And isn't it sad that our health insurance, not health care, health insurance system is all wrapped up in politics?
Right. Okay, well, again, if someone wants to investigate open enrollment, they've got to December 15th.
December the 15th is the very last day to enroll.
And the only provider around here is
Blue Cross and Blue Shield of Georgia. That is it. So regardless if you go...
Well, what's up with that? Because they dropped out. They dropped us a while back, and now they've picked us back up again. Mm-hmm. So what's up with that?
It's just the flip-flop of insurance carriers. They wanted to be in all the counties to where they had zero competition. Mm-hmm. So that's exactly what they're doing. Mm-hmm. But, and people still kind of have a hard time understanding that they only have one insurance carrier to choose from. Regardless if you're going on the marketplace getting a premium tax credit or you're coming off of the marketplace and going direct as you and I would, you still have one insurance carrier.
Do you see more and more people just going without health insurance?
It's kind of, I don't know, I would say 90-10.
But now they
10%
still,
without.
is that, because there was a report that the individual mandate, they were thinking about repealing it as part of the tax bill. And that's the part that says you're going to be
that
fined.
You have to have insurance. Right. Oh, and that was another thing that that just came out the other day. You remember the executive order, and I had talked about that at one point in time when I came in. Trump had did an executive order to where he wanted, he wanted to kind of lighten the idea of people being able to purchase insurance. For the premium tax credits and being able to file their taxes. Well, the IRS invokes the ACA individual health care reporting requirement. So as they get ready for the 2018 filing season, you have to have insurance and you have to report that you have insurance. And if you don't, then they're not going to accept your filing.
Are you kidding?
The IRS. It was posted October the 25th, 2017.
There's no way they can enforce that, is there?
I don't know. It's the IRS.
Well, yeah, that's right. They got the guns. Really?
Yeah.
So if you cannot prove you got health insurance for the next year, then you won't be able to file your returns. Mm-hmm. Are you serious?
I am serious.
That just doesn't... And
it goes totally against the executive order that Trump signed, I don't know, at the first of the year.
So is this a deep state thing?
Probably.
I mean, that's hard to... So then you would get a fine from the IRS for not filing your taxes.
You would get a fine for not filing your taxes.
And a fine for not having health insurance.
And a fine for not having health insurance.
Well, that's leaving us on a cheery note. I haven't heard that. So anyway, that's... So we all have to have health insurance, or we all have to. But now, if you pay the fine, then you can file your taxes.
Correct.
So either way, they want that money, but you can't file otherwise. Mm-hmm. That just doesn't seem to be legal. That would seem to be something you could challenge in court, like it would do you any good. Okay. Well, thank you for coming in and clearing all that up and telling us what the bright future is under Obamacare, the Affordable Care Act. Our gratitude this morning to Marcy Sanders Heath of Insurance Solutions. Tell us how to get in touch with you.
So I'm in Bremen, and you can call me at 770-537-5300.
And what's that good-looking website that you got?
It is insurancesolutionsofthesouth.com.
Really?
Yeah.
Okay, and you're going to come back again next year, 2018. We'll do it again.
Unless we have major changes that we
started in 2009.
Yeah.
And we keep going. All right. Thank you for listening to the Community Voice, brought to you by Tanner Health Systems. Stay tuned. We got great programs all lined up this week. You're in tune to WLBB Carrollton.